Hello, I'm Dr. Gregory Davis, gynecologist in Chico, California. Thank you for joining me. If you're like my patients and you're coming to see me for hormone replacement therapy, you've probably done a lot of research looking on the internet, you've talked to a lot of friends, and you have a lot of questions. Well, what we're going to do today is we're going to talk about hormone replacement therapy. We're going to kind of go over the entire process. I schedule hour appointments if you were coming to see me or for my patients, and so that allows us time to answer some questions and to cover everything in detail. So I hope that you'll find this information helpful for you. Okay, as we look at hormone therapy, we have to go back and take a look at what actually are your ovaries making. There's basically three hormones that your ovaries are making that we're going to discuss today. The first, of course, is estrogen. The second is progesterone, and the third is testosterone. So the way I think about your ovaries, I think about your ovaries as kind of like an office complex. The rooms are what makes the estrogen and the progesterone. The walls, the floors, the ceiling, the infrastructure is what makes the testosterone. So what happens to ladies when they start to go through the change, no matter what age that is? The first room that starts to become empty is the estrogen part of the factory. And so as the estrogen part of the factory shuts down, well, then you start to have some symptoms. And then the next thing is the progesterone. And then finally, though, the infrastructure starts to get smaller, and then the testosterone goes down. But let's take a look for a second, and let's talk about why estrogen is so important. Estrogen is important because you have estrogen receptors throughout your body, from your brain to your heart to your bones to your uterus, and those receptors need to be saturated with estrogen to get the desired effect. So when we look at estrogen therapy, there's basically two types of estrogen that your ovaries make. Your ovaries make primarily estradiol. That's kind of the workhorse from the time you go through puberty till the time you go through menopause. Now, when you get to menopause and your ovary is not making that estradiol, then you make a hormone from your adrenal glands that gets converted into your fatty tissues to a type of estrogen we call estrone. Estrone's about 10 times weaker than estradiol. So estradiol is the workhorse. Estrone's kind of your backup source of estrogen. During pregnancy, you make high doses of an estradiol. That's a different type of an estrogen that's just during pregnancy. And then that's the only time you really make that. But that's about 100 times weaker than estradiol. So if we look at what progesterone does, it only does two things. Progesterone is the hormone that brings on your period every month, and progesterone is the hormone that maintains your pregnancy. So that's why you'll see ladies who, they're maybe on hormone therapy and they go, well, I'm not on any progesterone. That's because once the uterus is gone, you're not going to have periods, you're not going to get pregnant, so you're not really going to need the progesterone. But here's the other thing that's interesting about progesterone. Where does the progesterone work in your body? Well, it only works in the uterus. So it maintains the pregnancy and it brings on the period. So that's where the progesterone receptors are. But here's the thing that's kind of interesting, is that when you have estrogen receptors throughout your body, and you have progesterone receptors that are only in the uterus, and your body makes progesterone, or you take progesterone, what's going to happen is that progesterone is going to competitively try to get onto those estrogen receptors. And when it tries to get onto those receptors, then you've got a problem, because now all of a sudden your estrogen can't plug in, and all of a sudden you'll have some low estrogen symptoms. So it's real important to kind of understand that progesterone is just for pregnancy and just to bring on the period. The third hormone your ovary makes is testosterone. Testosterone, what does that do? Well, testosterone mainly provides your libido, your sex drive. It helps a little bit with bone metabolism, helps a little bit with hair metabolism. But primarily, testosterone is providing your libido. So that's why when somebody has had a hysterectomy and their ovaries are taken out, 75% of their testosterone left when those ovaries went out. The remaining 25% is divided between your adrenal glands. So if your adrenal glands don't step up and don't make enough testosterone, then you're going to have a decreased libido. That's why if you've had a hysterectomy and you're on hormone therapy but you're not on testosterone therapy, you might benefit from a small amount of testosterone to kind of help increase that libido. All right, we were just talking about how the ovary makes three types of hormones: estrogen, progesterone, and testosterone. And remember, we talked about how you have estradiol receptors throughout your body. Well, what we're going to talk about now is your choices for estrogen today. Maybe you didn't realize this, but you have three choices of estrogen. Now, part of the reason there's confusion with different types of estrogen is that the FDA really doesn't distinguish between the three types of estrogen we're going to talk about. So let's look at the three types of estrogen. The first is going to be your natural estrogen. Another name for that is plant-based. Another name is bioidentical. So when somebody mentions any of these three, they're all talking about the same thing, which is 17-beta estradiol. So now, what type of receptors do you have in your body? You have estradiol receptors. So whatever type of estrogen you're taking needs to get in the form of estradiol for it to work. So your choices in natural plant-based estrogen are pills and patches and creams and gels and sprays, and these have been around since the late 1970s and 1980s. Now, let's talk about the second type of estrogen. There's animal-based estrogen, which is traditionally known as Premarin. Pregnant mare's urine comes from horses. This was first came about in the 1940s when it was developed, but it actually became popular in the 1950s and 60s, and this has helped millions of ladies because there was no other source of estrogen that ladies could use back then. And so it works extremely well, and it's helped a lot of patients. But it primarily is in the form of pills and creams that have to get broken down in your liver, and when it gets broken down, one of the products that comes out is estradiol. The third type is synthetic estrogen, which is manufactured estrogen. This came about in the 1960s with birth control pills. Once again, that's in the form of pills, and that has to get broken down into estradiol. Now, so the thing is that when you get prescribed estrogen today, you're primarily going to be prescribed probably Premarin, or you're going to be some sort of natural type of estrogen. But here's where the problem lies, is that when you get your prescription from your pharmacy, what happens is that the pharmacy is going to give you a little printout that tells you all the bad things that can happen from estrogen. Everything bad that's happened since estrogen first came on the market. So the FDA requires anybody that makes an estrogen product to put this in their brochure, everything bad that's happened since the beginning of time with estrogen when it came about. So if we look back in the 1950s when animal-based estrogen came about, well, the doses were fairly high. And obviously they had some problems related to that. But you got to remember, this is the practice of medicine. We're not perfect. We're getting better, and we're trying to learn from past mistakes. And so what's happened is certainly they made high doses, but you know what? They found out they didn't need those. And so the doses today on Premarin are very, very low, and they don't have those problems. But just remember, all the problems they had with the high doses goes into the brochure today. The synthetic, the birth control pills, well, those came about in the 1960s, and they were 10 times the dose of birth control pills today. Well, for crying out loud, they had tons of problems when those pills were those high doses. So in your brochure today, you're going to have all of the bad things that happen from birth control pills. Doesn't matter what estrogen you're given, you're going to have the same thing in there. So the FDA hasn't helped us by not talking about the different types. They just lump them all together. Estrogen is estrogen. So when somebody comes up to you and says, "Oh, I hear you're on estrogen, isn't that a problem?" Well, you should say to them, what estrogen are you talking about? Are you talking about natural estrogen? Are you talking about animal-based or synthetic? Well, of course, they're not going to know. But you're going to know because you've watched this and now you're educated and you understand that it's all relative. You have to realize that the FDA not only doesn't distinguish between estrogens, but it doesn't distinguish between dosages. Well, obviously, if you have lower dosages, you're going to have less side effects. So, the thing that's interesting is that when you look at all the studies that have been done on hormone therapy and all of these complications that have occurred, what they studied was animal-based estrogen because that makes up 80% of the world's market up until 2002. So if you're going to do a study, you're going to study what most people are taking. So you're going to study animal-based estrogen, and that's what they actually studied. So when you look at the results of that, and you realize, well, wait a second, that was animal-based estrogen. This is natural estrogen. What studies do we have showing with the natural estrogen? We don't have any studies. We have absolutely zero studies. And the reason is because you're going to study what most people are taking. So I just want to kind of clarify that when you look at your product brochure, what you're reading in there pertains to animal-based estrogen and some degree synthetic estrogen. It doesn't pertain to this at all. And the thing to remember, one other thing I was going to point out, is that it makes a big difference on how your estrogen is absorbed. When you look at it and you say, okay, your animal-based estrogen is a pill form, synthetic is a pill form. So what does that mean? Your pill has to go to your stomach. It has to dissolve. Then it has to go to your liver and get broken down. And then it has to be made into some estradiol, which then hits your estrogen receptors. So there's a lot of things that can kind of get messed up during then. If you're taking any type of antacid or Prevacid, Prilosec, Nexium, Actifex, all of those kind of medicines that decrease your stomach acid, you may not be absorbing your animal-based estrogen or your synthetic estrogen. In fact, we've had a young girl that's taken birth control pills that was taking one of those products, had such decrease in acid, she didn't absorb her pills and she got pregnant. So they do have an effect on your stomach acid. The other thing is, how many people are taking antihypertensives or high blood pressure medicine, cholesterol medicines, or taking anti-inflammatories? All of those affect how your liver breaks down these pills. So what's the actual ideal way for you to take hormone therapy? Well, the ideal thing would be to have 17 beta estradiol going straight to your bloodstream, because that's what your ovaries do. Your ovaries make 17 beta estradiol and release it straight into your bloodstream. So what if we could replicate that? Well, certainly we can. If we choose a natural estrogen, if we choose something that's in a patch or a gel or a spray, or sometimes in a cream, that is going to go straight into your bloodstream. So it's going to bypass your stomach, it's going to bypass your liver, it's going to float around your bloodstream, hit all those estradiol receptors, and you're going to get a response fairly quickly. So if you're going to take a hormone therapy, you're going to want to take something that's going to be 17 beta estradiol, that's going to go straight to your bloodstream. It's going to work faster, it's going to have less side effects, and I think you're going to find it works better for you.